video is reviewing the bony anatomy of the shoulder. So starting on the medial side, we have the Manubrium that sits on top of the sternum. When we look at the clavicle, we have the sternal end, and then we have the acromial end. Okay, the sternal end is flatter. Again, this articulation has less range of motion. The acromial end articulates with the acromion process, which we can see here. So this joint makes up the acromioclavicular joint. Which is supported by the acromioclavicular ligaments. Looking at the anterior side of the scapula, the area underneath the scapula that articulates with the posterior side of the thoracic cage is called the subscapular fossa. Again, that's where the scapulothoracic joint is. So it's the anterior side of the scapula articulating with the posterior side of the rib cage. Coming off the front, this prominence is called the Coracoid Process. And then coming off the posterior side, again, was the acromion that articulates with the acromial end of the clavicle to make the AC, or the acromioclavicular joint. The area of the humeral head where it articulates with the scapula is called our Glenoid Fossa. And that forms the socket part of the ball and socket joint. When we look at the scapula itself, the bottom angle is called the inferior angle. The border on the outside is called the lateral border. The inside is called the medial border. Then we also have a superior angle and a superior border. Looking from the posterior side, we want to start with the spine of the scapula. So that's right here. Again, that's called the spine. On the top, where we articulate with the clavicle, again, we have the acromion process. And then through here, off the anterior side, we have the coracoid process. Here we see our humeral head, and it articulates with the glenoid fossa. When we look at the posterior side of the scapula, everything underneath this spine is called the infraspinous fossa. And then everything on top is called the supraspinous fossa. We have the same angles as we saw on the anterior side. So the bottom angle is called our inferior angle. The border closest to the spine is the medial border. The border closest to the arm is the lateral border. The top point is called the superior angle. And then we also have the superior border. Here we can also see our supraspinous notch. Looking from the lateral side, we want to use the sternum in the front to determine which side is anterior or posterior. We can also look at the spine and the openings on the rib cage. So we have our acromion process on top. Remember, that is the process that sits more posterior and superior to the second process. The other process underneath is the coracoid process. Again, here we have our humeral head. We have the inferior angle of the scapula. We have the lateral border. On the underneath side, we have our subscapular fossa. And on the posterior side, we have the area below the spine, that is our infraspinous fossa. And then above the spine, we have our supraspinous fossa, with the spine being right here. Looking from the posterior medial side, here again we have that subscapular fossa. Again, that's where the anterior side of the scapula articulates with the posterior side of the rib cage. We have the spine. We have the acromion process. We have the coracoid process. We have the clavicle. Okay, and then again on the posterior side, everything below the spine is our infraspinous fossa. And then on the top, we have our supraspinous fossa. Looking more specifically at the shoulder joint now, keeping in mind that the shoulder joint is made up of the glenoid fossa and the humeral head. When we talk about the shoulder girdle, we are talking about the AC joint being the acromioclavicular joint, the SC joint being the sternoclavicular joint, and the scapulothoracic joint. On the humeral head, being here, we have this area of articular cartilage. That's the entire area that will articulate with the glenoid fossa. So again, this is the humeral head. Outside of that, we have the greater tubercle. We have the lesser tubercle. And in between the two, through here, we have the bicipital groove. Remember, this is where your bicep tendon runs. Further down the arm, about in here, we have our deltoid tuberosity.